Ever heard of the term scoliosis? No? Well, you're not alone. Scoliosis, while not a term commonly found in everyday conversations, is a medical condition that affects many. In simple terms, scoliosis is a condition where a person's spine takes on a sideways curve. Instead of a straight line down the middle, the spine appears to form an S or a C. Picture how an S or a C looks. Now imagine that shape in place of the straight line that is typically your spine. This curve, which can vary in severity, usually manifests itself during the growth spurt just before puberty. It's a crucial time when our bodies grow and change at a rapid pace. Scoliosis, however, throws a wrench into this natural process, causing the spine to develop a curve. Now that we have a basic understanding of what scoliosis is, let's delve a little deeper. Detecting scoliosis isn't always straightforward. This curvature of the spine is often discovered during routine school screenings or checkups with a pediatrician. Now you might be asking yourself, how is it detected exactly? Well, one common method is the Adams forward bend test. During this test, the individual bends forward at the waist, allowing the examiner to view the spine from a side angle. Any unusual curvature can be quite noticeable in this position, but a hunch isn't enough for a conclusive diagnosis. Enter X-rays, the definitive diagnostic tool for scoliosis. By casting shadows of the bones onto film or a digital sensor, X-rays provide a clear picture of the spine's alignment. This enables medical professionals to determine the degree and direction of the curve, crucial information for planning treatment. Early detection can make a world of difference, which is why regular checkups are crucial. So what happens once scoliosis is detected? Well, there's no one-size-fits-all answer to that. The treatment plan is tailored around various factors like the severity of the curve, its location in the spine, and the patient's age. One option is observation. This is usually recommended for mild cases where the curve is less than 20 degrees. The patient is monitored closely for any changes in the curvature. Then we have bracing, a more proactive approach. It's often employed when the curve is between 20 and 40 degrees, or if the patient is still growing and the curve is progressing. The brace doesn't correct the curve, but it can help prevent it from worsening. Lastly, there's surgery. This is considered for severe cases where the curve exceeds 40 degrees. The aim is to correct the curve as much as possible and prevent it from progressing further. While treatment can seem daunting, it's essential to remember that it's all about improving the quality of life. Scoliosis is not just about a curved spine. It's a complex condition that can manifest in several ways. Common symptoms include uneven shoulders, where one may appear higher than the other, a rotating spine that can cause the body to lean to one side, and chronic back pain that can be persistent and debilitating. Over time, untreated scoliosis can lead to a range of long-term effects. As the curve in the spine progresses, it can start to affect other areas of the body. In severe cases, the rib cage can be pushed against the lungs and heart, leading to respiratory and cardiac issues. Not to be overlooked are the psychological effects of scoliosis. The physical changes and chronic pain can lead to a decline in confidence and self-esteem, and the fear of progression can cause anxiety and stress. The impact of scoliosis goes beyond the physical, often affecting a person's psychological well-being too. Living with scoliosis is one thing. Life after surgery, that's a whole different ballgame. Prior to surgery, individuals with scoliosis often grapple with discomfort, pain, and even a sense of self-consciousness. The decision to undergo surgery isn't taken lightly, but is often a choice for a better quality of life. Post-surgery, the changes can be profound. There's a physical transformation, yes, but there's also a new sense of freedom. Freedom from constant pain, from the limitations that scoliosis may have imposed. But it's not an instant fix. Physical therapy becomes a crucial part of the recovery process, helping to strengthen the body and ensure optimal mobility. The journey doesn't end with surgery, it simply changes course. There will be challenges, sure, but also victories. Every step forward, every milestone reached is a testament to the resilience of the human spirit. Scoliosis is a journey, and like any journey, it has its ups and downs. But with the right information and support, it's a journey that can be navigated successfully.